Let's stay then with that story and speak to Denosa Acting General Secretary Kwena Manamela. Also joining us in this discussion is Dr. Sharon Vasuthevan and Life Healthcare Education Executive and the Department of Health's Chief Nursing Officer, Dr. Nonhlanhla Makhanya. Good afternoon to you all and thank you so much for your time. I'd like to begin with you, Dr. Makhanya. Does a day like this have any meaning?
Good afternoon to you and good afternoon, colleagues. A day like this can never have much more meaning than it does in year 2022. If we reflect on the contribution of nurses towards saving millions of lives that were affected by the COVID pandemic, this day cannot be much more meaningful to be celebrated and commemorated, particularly looking at the lives and the work that the nurses do, particularly in the public health service.
And for you, Dr. Sharon, as we've just heard Dr. Makhanya reflecting, what does a day like you have in terms of meaning and what reflections do you have today?
Well, I just think that International Nurses Day is a day in our calendar where we can totally, dedicate time to celebrate nurses and to show them our appreciation. I've been in this profession for over 40 years, and I believe nurses play such a significant role in terms of the healthcare system, and we would just not be able to do without them. And the recent pandemic was evidence of that. Nurses on the front line were the ones that sacrificed their lives, and it was one group of health professionals that we're there every day in close contact with our patients. So for me, we need to celebrate nurses almost every day because we need more of them in this country. And we need to attract young people to come into the profession. So for me, we need to pay more attention to what we'd like to see in healthcare and invest in nurses, as they say, according to the International Council of Nurses.
And I'll get to what that investment then looks like, because there's also concerns around the training gap when it comes to nurses. But I'll come to you, Kwena. There's a lot that nurses do in the healthcare sector. They are at the cold face of, the work when it comes to frontline workers during COVID-19, especially now in this pandemic. Are we appreciating them enough? Gwen, I think you are muted. Please unmute yourself.
Good afternoon. I'm sorry for that.
No
good afternoon
worries.
And good afternoon to fellow panelists. We are very happy that nurses this day are still able to stand on their feet and put a smile after what they went through. You rightly said they braved the cold face, they braved the new coronavirus that nobody nobody was aware of and how it should be treated. But we are glad. But as for your question to say, are they recognized or so, I would say no, because nurses are not asking much from their employer. They are just asking some form of a token to say, we recognize what you have been doing and we recognize what you are doing and we really appreciate your work that you do on a daily basis. But that didn't come forth. We're going to and fro with the employer on that part. The nurses haven't received that as yet. So a quick answer to that, I would say no. I don't think we get recognition that the nurses deserve, especially for what had happened and what they're doing currently.
I suspect, Kwena, you're talking about remuneration then in this case.
You can call it remuneration. They were asking it in many forms. Whatever form the employer can say, we appreciate what you're doing. It can either be a once-off token. It can be something that is incorporated into their basics also, but none of that came through. So I'm talking about a whole lot of appreciation that the workers would appreciate coming from their own employer.
All right. And when I come back then to you, Dr. Makhanya, because one of the things that is also of paramount importance is the issue of safety, because it's not only about remuneration, but we've seen even, for example, a nurse at New Somerset Hospital and her team, springing into action to calm and to disarm a patient who had, taken a police's firearm, and they killed an officer as well as two other patients. This is not unique to that particular hospital. We've seen reports of the safety issues that some of the nurses are finding themselves under. On a day like this is coming back again into the spotlight. How concerned are you about the safety of nurses in hospitals?
We are concerned about the safety of nurses in all health facilities, and we have programs in place that are looking into improving the overall practice environment, conditions of the conditions of work under which nurses work, including improvement of safety. However, without really underestimating the incidences, particularly the recent one of Western Cape that we have alluded to. We need to also appreciate that what we are seeing within our healthcare facility is a reflection and a manifestation of the nature of South African society that has become to have very violent, characterized by high level of violence that then tends to manifest in all sectors. And again, it calls for much more safeguard to make sure that our health professionals who do their work selflessly are protected.
And I see you are eager to respond there, Kwena. I'll come to you then and go to Dr. Sharon as we then look at the issue that looks into the future. Your response to what Dr. Makhanya just said.
You're coming to me?
Yes, Dr. Makhanya was responding to the issue of safety, and I saw that you were eager to jump in there and talk about that issue. What did you want to say?
Yeah, what I want to say is that the infrastructure in health facilities, I can say all over the country, is really deteriorating. Because we can talk about safety, but if the fences are not taken care of, I'm not talking about physical security, really sitting at the gate and looking after the workers that are inside. But the infrastructure itself is the one that is dilapidated to an extent that I don't know, it's not taken care of. And that is the one that creates a very great problem, because everyone who wants to do anything or harm to the workers or the nurses, they get, because the fence is porous, they get in anywhere. I don't want to talk about the issue of security that we've been calling for it for a long time, to say, can the department insource security and give parameters on how they should operate? Because we don't want to find a security is taking care of securing the workers. But he's got nothing to show that will show that he can protect if any danger comes his way. I don't know how they are categorized, but really is a problem when it comes to, it is shown by these many incidences that are taking place on daily basis. And they're even taking place in areas where you think those incidences will not take place, because we don't expect them to take place at the hospital level. More worse is at the remote areas where there is no access to transport, the roads are worse, there is no electricity and all that. I don't want to talk about those far-flung areas. The safety issue is worse.
It sounds to me,
in bigger hospitals like Somerset Hospital.
Pardon me, Kwena, it sounds to me like you kind of give a sense that it's not being prioritized.
It's not being prioritized, I should believe, because if for a long time we've been sitting around the table to say, can the government or the department prioritize the issue of security of nurses because of these daily incidences, and we see the infrastructure deteriorating on a daily basis, you can conclude to say it is not prioritized.
All right, and I'd like to move then to you, Dr. Sharon, before I come back to you, Dr. Makhanya. The issue of training is also one that is coming out from various bodies who are saying that there are colleges that were shut down, they need to be reopened and accredited, and this is going to address the issue of producing more nursing professionals looking into the future to ensure that you get more of them coming into the system. Could this help close the gap?
I definitely think so. I think the acceleration of training of nurses needs to be an item on the national agenda. The private sector, especially like healthcare, we are wanting to drive this and, jointly with the Department of Health and the regulator. And I believe that the numbers speak for itself. Currently, we estimate that there's a shortage of about 20,000 nurses. And already in the human resources plan, we estimate that there'll be a shortage of about 34,000 nurses by the year 2025. That puts the healthcare system into an immediate crisis. And we need to put our heads together and to work together as the public and private groups and really focus on what are we going to do to accelerate the number of nurses trained for our country, both at undergraduate level and at specialist level. We need nurses to keep the health system moving.
Dr. Makhanya, the WHO African region says that, this severe shortage of nurses, which if left unaddressed, poses a significant threat to our progress towards universal health coverage. And it talks about this at a continental level, but then also talks about South Africa, even being among those that are struggling with shortages, listening to Dr. Sharon as well. How then do we begin to address this particular issue? Because we do need more nurses to come in as others are retiring.
Thank you. I do concur with my colleague that one of the challenges or one of the strategic areas of intervention is actually to review training of nurses and decide the kind of skills mix that are required to meet the current and future healthcare needs within the healthcare system. We need to also view this against the growing concern in terms of consistent cutback of budget allocated to various departments and health sector in particular. On annual basis, we get budget cuts that have implications in terms of staffing, creation of posts, and dedicating to some of it in terms of mainly creating of posts and dedicating that to creating the post of appropriate nurses that are required. So even if we were to scale up training, it has to be aligned to it needs to be aligned to broader service delivery needs so that we make sure that we have the professionals with the right skills mix and not find ourselves with some of the nursing professionals that find themselves that they cannot be employable as they stand because of incongruency between of what is required within the system and the kind of skills that they have. And however, the function of the department is to be the employer. Therefore, it would be quite important for the department to have sufficient resources in the form of specific posts in various areas of nursing that are fully funded to be able to then absorb and absorb those nurses that are coming from training and be able to provide the required service delivery.
And Dr. Sharon, I'll come back to you before I move on to Kwena. The issue of the mental well-being of nurses is one that has come again in the spotlight given the COVID-19 pandemic. They're dealing with a lot. I mean, there was a point when the numbers were soaring, as we're starting to see numbers going up again now. Surely things were difficult for them in the different wards. How would you say this issue is being addressed?
Is that for me to respond?
Yes, Dr. Sharon.
Oh, thank you very much. I think that, a lot of initiatives were put in place, especially during the pandemic, to support our nurses. In many of the hospitals, psychologists were employed because we needed to do some debriefing with the nurses because of the kind of trauma that they were going through. This was an ongoing process. Lots of employee assistance programs were put in place And we continue to support them. And also for the managers and the leaders, they needed to be more resilient at this time. So many of them received coaching and support just so that they could keep the hospitals going. And I think that went a long way in terms of us showing support to our nurses. And we've seen a lot of appreciation for that. A lot of what we've learned from the pandemic, we feel that we want to continue doing, because for a long time we took this for granted, the debriefing of staff, especially when they're working in high care and intensive care units. And that is going to continue post the pandemic, because we believe that we need to invest in our nurses, we need to support our nurses, because their commitment and dedication is priceless.
And what are some of the issues, if you're able to share with us, Dr. Sharon, that they're raising in the debriefing? What are some of the difficulties that they have?
I think for them, there was a lot of challenge around, the number of patients they had to see, the number of deaths that they were experiencing. Some of their hospitals, the number of deaths they experienced in a short space of time, they hadn't experienced that throughout their time, in nursing. And suddenly to be faced with that, the fact that visitors were not allowed into the hospital meant that nurses had to double up and provide that psychological support to the patients, and also use technology to keep in touch with the patients' families. So all of that was very draining. We also need to understand nurses are human. They had sacrificed their families. They were actually exposing their families by coming into hospitals on a daily basis and being in contact with COVID patients. Even though all the necessary PPE was provided and everything was in place to support them, we have to appreciate the sacrifices made by these men and women during the pandemic.
And talking about appreciation, Kwena, for you, what would you say is working and is not broken with the system right now?
What is working in terms of the human resources? I think the support that the nurses are giving each other as colleagues, I think that is the one that is encouraging, that we see is working. And what the government has supplied during the COVID-19, they've tried their best in terms of the PPE, although we had some challenges with the quality of PPE and the numbers that were issued at the time. I think those issues were solved very quickly. I think the country was able to move swiftly in most of the areas in setting up the occupational health and safety committees that will look into all the qualities in hospitals and setting those committees that were not there initially. Because we are worried that if the committees are not there to monitor what is happening, we might have this challenge. As Dr. Sharon has said, that if the proper PPE is not supplied and those nurses have to go back to their families, they pose a danger to their families and their children. So I think in a way I would say government is moving swiftly in some of the areas, including the issue of the vaccine, so that the nurses are able to be protected and go back to their posts and work, having confidence that at least they've got a minimum protection against the virus. I think those are the areas that we will commend government from doing and moving swiftly. But where, I don't know if you want me to also add to say, we lost a lot of our colleagues during the pandemic. And then I think where the government didn't really come on board is replacing those we have lost, because like Dr. Sharon has said, we lost, but they were not replaced, and then it put a lot of burden to those that are left, and it put a lot of trauma. Now we need counseling. Now they've got the psychological problems and so on and so on. So I think that is where, like Dr. Makhanya was talking about, this what they will call technical moratorium at some stages, because we say there is a moratorium, they will tell you it's technical, there's no moratorium. But these austerity measures are the ones that are really bringing strain to the system itself. So, but anyway, we commend some of the issues that the government did during the COVID-19 for moving swiftly in terms of the protocols, in terms of the rules, as and when the the patterns are changing of infections.
All right, Dr. Makhanya, I'll give you the final word here. There's really the upside as well of being a nurse. Young people are watching this interview. They want to know, what would you say the upsides are to being a nurse? Because yes, there's the dangers that are posed by COVID-19 now and all of that, but there's also upsides to this profession.
I think am I muted?
No, we can hear you.
Okay, the upside really to being a nurse is that if, as a chosen profession, it really gives you an opportunity to serve humanity and have a direct interaction with the people that you are serving, your patients in particular. The upside is that you are able to be an advocate for patients' rights, not only making sure that they get their medication, but also really going beyond the call of duty, like we have seen in a number of incidents. That is where you really see the nurses who chose the profession and really becoming selfless in terms of putting the lives of their patients before their lives. So we really want to commend nurses who do all of that.
Indeed. Thank you so much to you all for your reflections today as we looked at the issues of training, the issues of their mental well-being, and also preparing for the future when it comes to the continuation of this particular profession. Thank you so much to you all. That was Dr. Sharon Vasuthevan. She is Life Healthcare's Education Executive. Kwena Manamela, Denosa Acting General Secretary. Dr. Nonhlanhla Makhanya, Department of Health Chief Nursing Officer. Thank you so much to you all.